Hello everyone. How much does a hernia surgery cost? So this is a common question which obviously will be there in every patient who is planning to undergo a hernia operation. The cost of a hernia operation ranges anywhere between 50,000 to even up to 2 to 2.5 lakhs. What decides this difference in cost? Why does somebody have a surgery for 50,000? Why is it so expensive for somebody else? There are so many factors which decide the cost of a hernia operation. Number one, what sort of operation is it going to be? Is it going to be a laparoscopic operation or a robotic operation or an open operation? Obviously, the cost and the equipment and the setup required for each of these surgeries is different, and thereby the final cost of the surgery also will be different for each of these operations. Second, what type of hernia are we treating? A groin hernia repair is not the same as a incisional hernia or a regular belly hernia repair, which is different from a small belly button repair. So these are different types of hernias which have different duration of surgeries, different types of mesh, and the recovery is also different. So depending on the type of hernia, the cost of repair will change. Third, what sort of mesh is being used? There are a wide variety of meshes which are available for repairing hernias. Namely, for the commonest mesh which we use is the polypropylene mesh. That has a cost. The meshes which we use for repairing belly button hernias laparoscopically are quite expensive meshes because they are called composite meshes. They have a non-sticky layer and a sticky layer. There is a special coating in them. These meshes can cost up to 4 to 5 times the cost of a regular open hernia mesh. Of late, there are special types of meshes called three-dimensional meshes, 3D meshes, which are very popular in the repair of groin hernias. These meshes, when compared to a regular groin hernia mesh, will cost up to 2 to 3 times more expensive. So depending on what type of hernia is being repaired and what is the type of mesh being used, the cost of the operation will change. Next comes, how complicated is a hernia? A patient can come with a 2 or 3 centimeter size hernia in a cesarean scar. There can be another patient whose entire intestines have come out of the abdomen, and that can need a very complex surgery which can last for 6 to 7 hours, where we do something called an abdominal wall reconstruction. So depending upon the complexity of the hernia, the duration of surgery might change, and of course the cost also will change accordingly. Next comes, does the patient have any other problems? Like you can have a very fit, healthy person coming for a hernia operation who gets the surgery and goes home the next day. You can have a very elderly person who has a previous heart issue, who has a brain stroke, who has high blood pressure, blood sugar, where after the hernia the patient needs to be kept in the ICU, has to be monitored, and he might take up to 5 to 7 days to get discharged from the hospital. So the expense of the operation, even though the same operation has been done for both of them, the patient with multiple problems will have a higher expense when compared to the regular patient. So cost of the operation depends upon all these factors. There is no fixed package for a hernia. It's usually tailored to the type of hernia, the type of mesh the surgeon wants to use, and the patient's condition.